Hi, my name is Brandy Butcher, and I am here to do assignment 5, Comprehensive Physical Assessment for the SIMPATH program, SIM 437. So with this assignment, I will discuss the digital clinical experience score that I received in Shadow Health, doing the comprehensive assessment. I will discuss the student performance index, subjective data collection, objective data collection, a care plan that I come up with, and the time I spent with the patient, and my self-reflection. So with this assignment, I was tasked to do a full clinical comprehensive assessment on Tina Jones. My digital clinical experience score was at 96.2%, and so that says that it measures my performance on the student performance index in relation to other students comparable to academic programs. So it rated me as proficient. It said that I did get most of the things that they were looking for correct, like as far as asking what I needed to ask. So with that being said, I spent quite a while on this assessment, and I think that it relates to my current clinical practice. This is a comprehensive exam, so I work in the emergency room, so I usually do more of a focused exam. I focus on whatever problem they're there for. There are instances in which I have to do, a full comprehensive exam if patient is unresponsive or I'm just unsure of what's going on and it warrants a full body examination. So I really did enjoy this assignment because it helped me to be able to learn in a training atmosphere, and to be able to streamline my process in general. The performance index and how it results to my clinical practice. Like I said, I don't usually do a full comprehensive exam, so this was very eye-opening for me. Subjective data collection. So the subjective data collection says that there were 33 out of 33 things that they kind of want you to hit on. So I asked all of those, and basically I let the patient lead the interview. So I introduced myself, I asked her what brought her in, and then we kind of went from there as far as asking about her health problems, and she reported that she has diabetes and asthma. When the last time she visited her healthcare provider, it was 4 months ago, and she had also been to her gynecologist. Her last full physical examination was 5 months ago. I asked about her current medications. She takes diabetes, and she has an inhaler and takes birth control. I followed up because a lot of patients will tell you that I take diabetes medicine, high cholesterol medicine, high blood pressure medicine, but it's important to know exactly which those medicines that they are taking and how many a day they take and what milligram it is, just because certain medicines will interact with each other, so you need to make sure that you are reporting everything accurately. So I asked about each of those medicines to find out when's the last time they had it and what the milligram was. And then I asked her about over-the-counter medicines. She occasionally takes ibuprofen, and about any allergies, and then how she manages her diabetes and if she does glucose monitoring, asthma symptoms, her vision, reproductive system, And I went through each system basically and kind of asked if she was having any problems with any of those. As far as most systems, she was there for a comprehensive exam for her job. She wasn't really reporting any issues. However, she does have asthma, and she said that she had a difficulty breathing the day before because she had run up the stairs too quick. She said, and what usually triggers her asthma is cats, and it has been very well maintained, and that she doesn't use her inhaler more than twice a week. The objective collection of data was, it says there were 69 out of 73 that they wanted you to touch base on. So 73 altogether, and I only got 69. So that would imply that I missed some of them. So I inspected her head and neck. Basically, on the objective data is things that I actually did in my exam that I can't change. Like I auscultated lung sounds, and they were clear in all lung fields. I listened to her bowel sounds, and she had positive bowel sounds in all 4 quadrants. So that is objective. Like if she didn't have bowel sounds, then she would have absent bowel sounds times all 4 quadrants. I can't change that. That is an objective finding for me. So it says that what I missed was when I inspected her interior eyes with the ophthalmoscope, I noticed that there were mild retinopathy changes on the right, but she had a left fundus with sharp disc margins and no hemorrhage. And this says that the patients with diabetes are at risk for diabetic retinopathy. So you should look at the fundus. So I forgot to look at the fundus. And then also I auscultated all breath sounds. And it looks like that I forgot to listen to the left carotid artery. So that's what I missed on my objective findings. And then care plan. So while I was talking to Miss Jones, she had mentioned, I had asked her about her diabetes and how she managed it. And she had mentioned that she was taking metformin now, and she takes it every day. But I asked her if she was taking any insulin, and she said no. I thought people with type 2 diabetes didn't need insulin, which is good because I definitely wouldn't want to have to inject myself with something every day. So the care plan that I picked was knowledge deficit related to misinformation or misunderstanding regarding diabetes type 2, as evidenced by her verbalizing that she did not realize that people with type 2 diabetes could take insulin. As far as my NICs, I did teaching that I would do teaching with the patient about disease process, that I would also do teaching with the patient on how to manage the disease and teach the patient the proper diet and maintain blood sugar. For my NOCs, I picked patient will be able to verbally discuss diagnosis and disease process. Patient's A1C on lab work will be under 8%, and patient will be able to identify healthy food choices to maintain diet. So, I did do, while I was doing my comprehensive assessment, I did educate her and tell her that with proper diet, that they can avoid having insulin, but sometimes it is necessary if the metformin and her sugars are not running the way they should be. As far as time and interaction with the patient, I spent a total time, I spent 152 minutes, and 2 minutes of that was just the reflection. The overall, actually assessing was 150 minutes. And then, so my self-reflection. So at the beginning of this comprehensive assessment, we had the planar exam. And like I said, it's not something that I do every day because I am more of a focused exam department. So I thought that I had it all planned out to where it would kind of be streamlined and that it would go quicker. But after I was actually assessing Tina, I realized that I did not have it set up in the most efficient way. So sometimes I would have her lay down and then sit up and take her clothes off and put her clothes back on. So I was not efficient with my time or her time or my assessment. So I think that just this process in general will help me to be able to streamline the process moving forward with my assessments, and that way it's more time efficient for me and the patient, and it is just a better flow, and then I'm able to assess the patient in a more efficient manner. I do feel that this simulation is great learning to help with that, but I do think that when I'm with the patient, I'm able to think of what I'm doing a little bit better and stay on task what I need to do in that order. But I do love that I'm able to do an assessment on a patient in a simulation and be able to tweak it, to modify it, and to work on it to fit my current practice and my needs as a provider, as well as to be able to provide adequate care to my patients. So that is my presentation for the comprehensive assessment for 437. Thank you so much.